Thank you for joining me today. In this video, we want to learn more about endocrine disorders that affect mental health. And we want to learn more about endocrine disorder, diabetic that affect mental health. Endocrine disorders are among the most common medical conditions that present with psychiatric symptoms. Hormonal imbalance can significantly affect brain function through affecting on neurotransmitters. And it also affects neuroplasticity, resiliency, metabolism, inflammation, hypothalamus-pituitary gland, and adrenal axis. Consequently, patients with endocrine disorder may present with depression, anxiety, cognitive impairment, psychosis, mania, sleep disturbance, personality changes, and delirium. Conversely, individuals with serious mental illness are at increased risk of endocrine disorders due to their lifestyle, chronic stress, or face effects of a psychotropic medications. So taking psychotropic medication can affect endocrine. Also, the lifestyle can affect the endocrine and chronic stress. However, if the patient have endocrine disorder, that can also lead to mental illness because the hormonal imbalance leads to depression, anxiety, cognitive impairment, psychosis, manic, sleep disturbance, personality changes, delirium. So it will cause you mental illness. Clinicians must recognize this relationship between the endocrine disorder and psychiatric disorder to ensure an accurate diagnosis and appropriate lab evaluation and integrated management. So we're going to explain how endocrine dysfunction contribute to psychiatric symptoms. How do they cause anxiety, depression, and mood disorders? We want to learn differentiation, primarily psychiatric disorder from endocrine-related psychosis presentation. We want to recognize endocrine disorders commonly associated with depression, anxiety, psychosis, and cognitive impairment. We want to interpret the lab. We want to learn that. Develop evidence-based treatment plan and integrate psychiatric and endocrine care. So we want to treat both the endocrine and psychiatric disorder. We want to learn how to monitor metabolic complications associated with psychiatric medications. So endocrine system include hypothalamus, pituitary, thyroid gland, hypothalamus gland, parathyroid gland, adrenal gland, pancreas, ovaries, testes, those are the glands. Hormonal disturbance may directly affect central nervous system function and contribute psychiatric disorder. So the relationship between endocrine disorder and mental health, because hormones influence neurotransmitters. Hormones affect neurotransmitters. They affect serotonin, they affect dopamine. So endocrine disorders affect serotonin, dopamine, norepinephrine, gabapentin, GABA and glutamate. How do they affect? Serotonin regulate mood and anxiety and appetite. Dopamine regulate reward, motivation, and psychosis. Norepinephrine regulate attention, arousal, stress response. GABA regulate anxiety. Glutamate regulate the learning and concentration. Improves or lowers the learning or concentration and cognition. Disturbance in hormonal status can cause depression, anxiety, mania, cognitive dysfunction, psychosis, delirium, sleep disturbance, weakness, behavior changes. For example, diabetic is endocrine disorder that can cause mood changes, that can cause psychiatric disorder, that can cause depression, anxiety, cognitive dysfunction, and acute psychosis symptoms. So diabetic causes depression. Low blood sugar will cause depression. Reduced medication compliance can lead to depression. Increased diabetic complications leads to depression. And it leads to mortality. Those symptoms include fatigue, sadness, hopelessness, sleep disturbance, poor concentration, also depression, anxiety. Diabetic can cause anxiety, can cause general anxiety disorder, panic disorder, fear of low blood sugar, excessive health-related worries, and diabetic-related stress. Cognition. How diabetic affected their cognition? Chronic hypoglycemia increases risk of cognition impairment. If your blood sugar is high, it affects your brain. It damages the brain cells because brain cells cannot deal with a lot of sugar, so it affects them. Vascular cognitive impairment. It causes vascular cognitive impairment, dementia, executive dysfunctional, slow process speech, So it affected the cognition, it affected the speech, it affected the memory. It causes anxiety, confusion. When your blood sugar is low, it can cause, you will feel anxious. The patient will feel anxious, confused, agitated, irritability, mood change and behavior change. Some of the patients may hallucinate. It leads to seizure. Low blood sugar can lead to hallucination, seizure, delirium, and coma. Increased blood sugar can lead to fatigue, poor concentration, irritability, delirium, confusion, decreased level of consciousness, and coma. So you want to assess the blood sugar level, medication compliant if they are taking their medication, diet and exercise, depression and anxiety, SI, substance usage, sleep quality, cognitive function, diabetic stress. You want to help them to have social support. You want to evaluate and assess the lab for A1C, blood sugar, fasting blood glucose, random plasma glucose level, comprehensive metabolic panel, liver panel, lipid profile, urine albumin to creatinine ratio, because sugar damages the nerves and kidneys. So you want to also do the renal functional test. You want to assess the thyroid disorders, hypothalamus, depression. You want to assess those thyroid disorders. Hypo or hypothyroidism, endocrine. You want to assess also renal Cushing syndrome, Addison syndrome. You want to assess what causing the endocrine disorders. You want to assess the psychotropic medications that affect the endocrine. You want to assess the weight. You want to assess the blood pressure, blood sugar, lipid, lifestyle changes. You want to teach them lifestyle changes. You want to also assess the symptoms and treat the symptoms like anxiety, depression, mood changes. You treat the endocrine disorders, and then you treat the psychiatric disorders. So always consider endocrine disorder in a patient with new onset of depression, anxiety, psychosis, manic, cognitive impairment. Always, if they have these symptoms, you have to check the endocrine disorder, especially when combined with the systemic symptoms. Routine lab evaluation for psychiatric patients often include thyroid, blood sugar, comprehensive metabolic disorder, because psychiatric medication can affect the thyroid, increase your blood sugar, increase metabolic panel because it increases the weight, appetite, depression and anxiety evaluation with people with diabetic disorder. If their blood glucose is worsening because some of the psychiatric medication can increase the blood sugar level. You want a treatment if they are complying with the treatment, long-term outcomes. You want to integrate behavior and diabetic care to improve both psychiatric and medical conditions. You want to monitor the patient taking second generation antipsychotic, lithium, valproic. Those affect the endocrine and metabolic. You want to collaborate closely with the primary physicians, endocrine specialist. You want to effectively manage you want to manage both the endocrine and psychiatric and medical conditions and provide patient-centered care to address the psychiatric symptoms, endocrine disease, lifestyle modification, medication compliance, education, ongoing monitoring to optimize mental health and physical health. Thank you for joining me today. I would love to see you in my next video. Thank you.